Hello, good people. How are you today? I hope that you are doing well, and I hope that you are just having a really fantastic day. So, today is June 8th, which makes it the 8th day of Uterine Cancer Awareness Month. And as you know, on this channel, we talk about all things uterine health. And I consider myself a uterine health advocate. So I committed to posting something every day during the month of June, or as much as information as I can find, to provide information on this channel, whether it's about uterine health or uterine cancer. So just want to let you know the purpose of me doing this every day. And so I just also want to take the time to say thanks for engaging with the channel, from your views, commenting, sharing, liking, your questions, and things of that nature. I really appreciate it. So thank you so much. So once again, as always, there's a disclaimer in the bio, but I always like to say I am not a medical doctor, but I am a uterine health advocate. Yes. So today I want to take the time to, sometimes I laugh at myself. It's so important to do that. Today I want to take the time to share a few myths regarding uterine health. And what I did, sometimes when I come up with these topics, these are just questions that I ask my own self, right? So I went out there per usual and just did a quick internet search. And this is what this topic will be today from what I found on my search. So the question that I put in, what are the top three myths regarding uterine health? And I wound up getting five. I wound up getting five. So I just wanted to also say this too. My purpose in sharing the information today and any part of my journey or anything that I post on this channel is to be informative, right? I believe the more that we become more knowledgeable and equipped with information, it just makes for a better meeting with your doctor. It helps you make a more informed conversation, questions asking to your doctor. And I think this leads to better, a better plan or better decisions regarding your health journey. I know probably in the past, whatever the doctor said was correct, and we listened to the doctor, and then that was it. And when we listen to some of the older, well, I won't say older men, I say our elders or people that have been through some things, we see that sometimes they'll say, in hindsight, they would have done this, this, and this. And we also see as modern medicine is progressing and things that what was not a good procedure in the past is now they have other things to do, or what maybe would have ended the life of women in the past. It's not now due to modern medicine and sciences and things of that nature. So I just want to put stuff on this page, this channel, where you can be informed and you can know about things that might be a possibility that maybe you never even heard of. And I'm growing too as I'm doing my research. Okay, just thought I would throw that in there. So I also think it's important for us to know fact versus fiction, right? And I also think it's important for us to know not to let other people's fears about what they heard be a determining factor of how we proceed in our journey in choosing the best plan for our medical care, right? So we don't want to listen to fiction or stuff that's made up and we don't know it to be fact because we haven't done our research, and we don't want to I heard this, so I don't know if you should be going that route, to prevent us from having the best quality care as possible. So that's another thing. We have to remove all of these misconceptions that can prevent and sometimes even delay a diagnosis to ensure that we seek proper medical care. And I always, always advocate for you seeking proper medical care from a medical doctor, is what I firmly believe in. So we're going to get into these myths, right? The five of them. So the first myth is severe period pain is normal. So the first myth is severe pain during your menstrual cycle is normal. So the reality, it says, is that you could have like mild cramping, which could be a standard part of your your menstrual cycle, or it could not be. Because again, I keep iterating too that all of us are different. Our bodies are different. What one person suffers from, another person may not. So everything is always different. Sometimes someone can take some medication over the counter and they're fine during their menstrual cycle, and others cannot. Some of them have debilitating pain, which forces you like to miss work, school, or daily activities. And so that's not normal. So severe period pain is not normal. Okay. So if you have any kind of severe, pain during your menstrual cycle, it could be a cause for any other kind of underlying conditions. Why I'm always saying go see your doctor, right? So like it says here that it could be a condition like endometriosis, which is what I talked about yesterday, or it can be you see, I still got my card here. I'm still learning how to say it. So it could be endometriosis, right? Which I talked about the other day. So you just never know if there's a cause for your severe menstrual pain, and it may not be a symptom or something that they can diagnose. But please, whatever you do, go speak to a gynecologist regarding the symptoms you're having that is really disruptive to your life, because I know that you want to have an everyday life and not to be just totally bedridden during that time. The second myth is that uterine fibroids are always cancerous. So the second myth is uterine fibroids are always cancerous. So the reality is that, when you hear the word tumor, it is often associated with cancer. And so, many women can worry when, the doctor comes back and say, we see tumors, and they say, we see fibroids, and you may have like 30 of them, right? Or you might have one. You just never know. You might have one this size, or you might have one this size. You just never know. They come in different shapes and sizes, what I'm learning now. And, but the one thing that they've been saying, and doctors have been saying that that fibroids are almost, because they can't say 100% because they could not say that, are almost exclusively benign growths. So the tumors, the fibroids that's in your body, they are non-cancerous growths. So the myth that they are cancerous is not true. They say that that's not true. So what you should do is still go see your doctor, because one thing that we're learning and we hear more and more people talk about, fibroids can cause heavy bleeding, can cause severe pain and discomfort. It can cause pelvic pressures, bloating, and just all kinds of other things. So that's why if you do have heavy bleeding, you may come to find out that you actually have fibroids that's doing something in your body. So then you can be diagnosed with a condition and you would know, okay, this is the fibroids causing this bleeding, or it might be endometriosis, or it might be something, or it might be nothing at all. So that's why I think it's so important, to make an appointment to see your gynecologist. And again, I believe that when you make an appointment to see a doctor, you are making a plan for your health to bring healing towards your body, because who wants to be in discomfort and pain all that time? And we're at a point now, hope I can say this correctly, where we can go to the doctor, we can receive medical care, and we should take advantage of it if it's available to us. I'm kind of hesitant to say this because I do know there are people that don't have that option. So I'm very reluctant to say this. So maybe I'll say, for those of us that do have the opportunity to have health benefits, to have where we can go to a doctor, that we should take advantage of it. If we're in any level of pain or discomfort, that we go seek that out, because I don't want to be disrespectful or insensitive to people that don't have health insurance or don't have access to good quality health care. I never want to be insensitive and not have any kind of empathy and compassion on that regard. So our third myth is that a hysterectomy is the only solution for fibroids. And so the reality of that is, historically, especially among African American women, that removing the uterus, which is the hysterectomy, was the primary medical response for fibroids. They just would say, "Oh, you have to have your uterus removed." And so a lot of women, even early on in their life, had their uterus removed, and they didn't really have to now, as we're seeing with a lot more medical science is being advanced and things of that nature. Today, people are having myomectomies where they're just having the fibroids removed, and that's where the surgery is done, like on the front part of your stomach, and they're just having it, removed. Some people are having uterine fibroid embolization, which is UFE, which cuts off the blood flow to the fibroids and shrinks them. I see a number of doctors having mixed commentary on that. So that is why I think that you should do your research and make a plan with your doctor to see what is best for you. But do your research. Look up not just one place. I always try to look up 3 or 4 places if I'm trying to make a decision, especially when it comes to your health, because you want to know the pros and cons of having a myectomy or a UFE. So make sure you do that. Maybe even discuss it if you may find someone that, really that's their specialty is fibroids, and you may be able to see that. There are a lot of good people that specialize in fibroids that I have seen online. So that may be an option for you. Okay. Oh, and one other thing I wanted to say too about fibroids, you should definitely go see a doctor, because sometimes I've heard where the fibroids could be blocking apart or blocking, or something is happening that it might be preventing you from having children. So it may be an infertility issue as well. So it's important that, once you know that you have fibroids, I would ask the question, where are they in my body? And what does this mean? What does this mean? It all depends to me what stage you are in your life. If you're a young woman and you want to have children and all those things, or are you, in your 70s? So it just depends. Is it causing you pain, or is this not causing you any pain? So I think you need to make that decision for yourself, which is why I say be informed before you even go to your doctor, so you can have a very good informative conversation about making a good health plan. So the fourth one, is, and these are in no particular order, by the way. So the fourth one is a tipped uterus causes infertility. So a tip uterus, they call it retroverted, but a tip uterus means that your uterus tilts towards the back, towards your spine, instead of towards the front, forward. So which can prevent the sperm from reaching the egg. That's the myth, that because your uterus is tilted towards the back and not the front, that the sperm can't get to the egg. So what it says was that this is something normal, but it only affects around 20 to 25% of women, and has no impact on a person's ability to conceive or have a healthy pregnancy. So even if they tell you that you have a tipped uterus, you can still get pregnant and have a healthy pregnancy at that. So don't believe that myth that you can't get pregnant because your uterus is tipped. So the last one I'm going to discuss is this, that a hysterectomy instantly triggers menopause. So the myth is that, removing the uterus automatically forces the body into surgical, menopause. And I guess that's a very good thing to discuss, because we are seeing more and more younger women that are in the age and the range, according to medical science, where they would be having children. And a lot of them are having hysterectomies, because I still think that some doctors are still prescribing that as the only option, excuse me, for some various things that are happening in women's bodies. I do believe that. And in some cases, the hysterectomy is the only solution, and it brings healing to a woman's body. But to break that myth is that a hysterectomy only removes the uterus, which stops your menstrual flow. So having your uterus removed only stops your menstrual flow, is what it says. Menopause is triggered by the ovaries, which I'm just learning, right? Which controls hormone production. So if the ovaries are left intact, the hormone levels remain normal. So that means, I guess, if you have a hysterectomy in your early 30s, you're not going to have instant menopause. It'll come when it's supposed to come, I guess. But I say this: our bodies are different. We're different as women. I'm starting to see, as I'm doing more research, things are affecting one racial group more than another group, right? So although these facts are here and then they're debunking them, I still think it's important for you to go see your doctor, for you to talk about things and develop a good plan that's for you. And even if you go to the doctor with your myths, with your, things that you heard of somebody say, they should be well equipped enough now to say, no, that's something that's not true, this, and that. They should be able to do that. And I say select a provider that you feel comfortable with, that you feel like you're getting the best quality care for yourself. That's what I say. I say that if you take the time, once you feel the discomfort and the pain, to go and make that step to go see the doctor, then you should be at a place where the doctor is also realizing you're there to seek healing, and that you guys can have a good medical conversation. I guess I'm keep striving that, because a lot of times we just, we go to any old doctor because they're a doctor. And no disrespect, because they all went to school for so many years, but I'm starting to hear some of the things that they were learning, especially when it comes to stuff when it deals to with Black people, Black women, that those things are not factual, right? And they're learning this as we are growing. So that's why it's important for you to know your own stuff, your own research, so you can present things to your doctor, because you may be helping your doctor as well, which will be great for the next generation. So I just wanted to quickly come on here and talk about some myths, because that was like, on my brain today. So I hope it's helpful. And again, if you're having any level of discomfort, any pain, please, please, please go see your doctor and really select one. And let me just say this: your friend may go to a doctor and that doctor is perfect for them, or this doctor may be all the rave, but that might not be the doctor for you. And it's like that when you're selecting maybe schools for your children, you're selecting a place to work, college you want to go to, whatever. It might be good for everyone else, but it's not the best thing for you. So please, get centered and alone by yourself once you finish all of your research, and really start picking what works best for you. Because as women, we make so many decisions and do so many things for other people. We really have to be strategic in how we manage our health and what's better for us. Okay? Well, that's it for day 8. Day 8. I almost forgot today was June 8th. So I will talk to you later. I hope you have a great day.